Today I'm gonna perform hand hygiene. Good afternoon, my name is Kareli. I'm gonna be performing an abdominal examination today. Before we start, I just wanted to ask you, did you agree and give consent for me to upload this video on YouTube for my class?
Yes.
Okay, so we're gonna proceed. Can you please lay flat, please? So for positioning, I'm gonna put this pillow underneath your legs so your abdomen is nice and relaxed and you're comfortable. Do you feel comfortable?
Yes.
Okay. So next step, I'm gonna ask you to please lift your shirt up. Okay. And the first step of my examination will be the inspection, which means that I'm gonna be looking at your abdomen and the overall skin. I look at the sclera of your eyes, and the skin in the abdomen, there's no jaundice, which means that it's not yellow. The tone is nice and pink. I also know that there are no rashes, there's no bruises, there is no pulsations, no peristalsis, no movements, and no apparent inflammation or any cut. So after this, I'm gonna proceed and I'm gonna start listening to the abdomen with my stethoscope. Okay, so I'm gonna listen to all the 4 quadrants of the abdomen. First, the right upper quadrant. And by doing this, I'm checking for vowel sounds. Then the left upper quadrant. Then the left lower quadrant. And finally, the right lower quadrant. The vowel sounds noted were normal active in all 4 quadrants. Now I'm gonna change my stethoscope and I'm gonna listen to the different arteries that are included in the abdominal region, okay? So first I'm gonna try and listen to the aorta. And then I'm gonna listen to the renal artery on the right side. Then the renal artery on the left side. Then the iliac artery for the right side. And then the iliac artery on the left side. Finally, I'm gonna listen to the femoral arteries. First one on the right side. And then the femoral artery on the left side. Okay, so upon auscultation of the aorta, the renal artery is bilateral, the iliac artery is bilateral, and the femoral artery is bilateral. There were no bruits noted, and that's normal. Okay, now I'm gonna proceed with the next part of the assessment, which is the percussion. I'm gonna be tapping on your abdomen to listen to the different sounds that your abdomen makes. And this is to identify if there's fluid in the area, air in the area, or there's a solid mass, okay? So I'm gonna start with percussion on the right upper quadrant. And what I'm hearing right here is tympani. Then on the left upper quadrant, again, I'm hearing tympani. Then the left lower quadrant with tympani as well. And then the right lower quadrant, which is tympani as well. Tympani is normal all throughout the abdomen. Another percussion that I can do is to check if the bladder is filled, which will make a dull sound. In this case, patient just emptied his bladder, so the bladder sounds tympani with percussion. The next step is I'm gonna measure the liver and try to feel the edges of it. So what I'm gonna do is in the mid-clavicular line, I'm gonna start on the right next to the umbilicus, and I'm gonna percuss until I hear dullness. And then I'm gonna do it between the ribs as well, in the intercostal space, which I hear dullness right here. And then I'm gonna go down from the mid-clavicular, and I'm gonna do this as well, which is a percussion. I'm gonna go down, and it's right about there. So my ruler, it's over here. I'm sorry about that. So let's locate that dullness again. Okay, so this is my mark right here, and I measure it, and it measures around 5 centimeters, which is a normal finding for the liver. The next step is I'm gonna percuss the spleen, which will be mid-axillary to the left side anteriorly. So I'm gonna locate the area. I'm gonna do it on the intercostal spaces. In this case, the normal finding is to not hear dullness. If dullness were to be heard, that will mean that the spleen is inflamed, and that's abnormal. But I heard tympani, so that's a normal finding. The other part I'm gonna do is palpation. So I'm gonna start with light palpation. So do you have anything in your abdomen that hurts right now?
No.
Okay, so let me know if you feel pain when I'm doing palpation, okay? So light palpation, I'm gonna start with the right upper quadrant, and then the left upper quadrant, then a left lower quadrant, and now for the right lower quadrant. There were no masses felt. There were no the abdomen is nice and firm and soft. I mean, if the abdomen were to be firm, then that could be abnormal, but this abdomen is soft, and that's normal finding. So what I'm gonna do next is I'm gonna do deep palpation. Okay, let me know if anything hurts. Okay. Palpation on the right upper quadrant, the left upper quadrant, the left lower quadrant, right lower quadrant, and that's done. Do you feel any tenderness, any pain when I was doing?
No.
Either for the light palpation?
No.
No, for the deep palpation. Okay, so patient did not feel pain. There was no tenderness in the abdomen with light palpation or deep palpation. I didn't feel any masses, no pulsations. So all of these will be normal findings. After, I'm gonna try and palpate for the edge of the liver. So this might be a little uncomfortable, but you shouldn't feel pain, okay? So I'm gonna grab from the intercost, like the below the rib cage on the right upper quadrant, and I'm gonna ask you to feel deep breath, please. Okay, and let it go. Okay. So that was no rigid edge to the liver, it was soft, and that is a normal finding. Then I'm gonna palpate. Also, there were no masses, and the patient reported, did it hurt?
No.
Okay, so no tenderness. Next, I'm gonna do the same, but for the spleen. So the spleen is located in the left upper quadrant below the rib cage, and I'm gonna ask you to do the same thing. Please take a nice deep breath. Let it go. Okay. Was that painful for you?
No.
Okay, so there was no tenderness. The spleen was not palpated. If the spleen were to be palpated, it meant that the spleen might be inflamed. So in this case, this is a normal finding. Now we are going to proceed to special tests. This is to identify if you have any conditions like appendicitis or cholecystitis, okay? So what I'm gonna do is I'm gonna do the Murphy's sign first, which is on the right upper quadrant of the abdomen. I apply deep palpation, and I'm gonna ask you to take a deep breath, please. Let it out. Did that hurt? Okay, so with this test, it's negative, which means that the patient does not have cholecystitis. If the patient were to have tenderness with this movement or stop breathing, which means that it would stop the inhalation, then that means that the patient might have cholecystitis. The next one is gonna be the McBurney's point, which is for appendicitis. In this case, I will locate the iliac crest, the right iliac crest, and then the umbilicus, and draw a diagonal line. In the middle, it will be the McBurney's point. So I'm gonna ask you again, take a nice deep breath, and then let it go. Is this painful for you?
No.
Okay, so this is a normal finding. Patient has no tenderness at the McBurney's with the McBurney's, so that is negative for appendicitis. The other test that I'm gonna do in the abdomen is the dullness shifting, which is done when ascites is suspected, which will indicate that there's fluid in the abdominal area. For this patient, the dullness will not be heard because he is healthy. But pretty much what it is when the patient is laying flat, the fluid will go to the lower part of the abdomen. So what I will do to do this test is do percussion on the top part. Of course, it will be part of the assessment. And then the top part will be tympani. But when doing the lower part of the abdomen, if the patient has ascites, since the fluid is gonna go down, then that will mean that the patient has ascites, and it will be dullness on the lower parts of the abdomen. I'm thinking that with my abdominal exam in this part, can you put your shirt on, please? And I'm gonna ask you to sit up for me. The last test that I'm gonna do is the CVA, which is the costovertebral angle for tenderness. I'm gonna palpate on your back and percuss on your back. Let me know if it's painful, okay? So first I do direct, this part right here. I mean indirect. And I compare sides. Was that painful for you?
No.
Okay, so that is the indirect. And now the direct will be directly tapping on the back part. Is that painful?
No.
So patient is negative for CVA tenderness. That will be the end of the examination. Do you have any questions?
No.
No? Okay, well, thank you so much.
Thank you.
Performing her hand hygiene and leaving the patient.